So welcome everyone to the Society of Thoracic Surgeons General Thoracic Surgery Database monthly webinar. Today is Wednesday, October the 9th, 2024. So thank you everyone for joining. I cannot believe we are already in October. In terms of agenda today, I'm provide some STS updates, and then Paul and Banu are going to give a presentation on the STS database platform access, and then we'll turn things over to Ruth for just a few educational updates. And then, as usual, we'll finish things off with our Q&A. If you have questions, please be sure to submit those via the Q&A function. We also have the raised hand function enabled, so if you'd like to just ask your question, you're welcome to raise your hand. Just ensure that your microphone is enabled on your end. On the call with me today, let's see here, on our panelist side, we've got myself and Emily Conrad, Carol Crone, Nancy Honeycutt, Paul Meehan, Banu Yatsi, Katie from our core group, and Ruth from our core group / GTSD consultant. So thanks everyone for being on with me today. Let's go ahead and hop into the STS updates. If I can find my cursor and advance the slide deck. All right, STS updates. The October training manual will be posted. It'll likely be posted either later today or tomorrow. It's with marketing, so Grace will get that updated and posted as soon as possible. The FAQ summary, again, just a reminder, will include both of those September and October updates. So be sure and check out that FAQ summary for a quick glance at what has been updated. Our STS Data Manager Collaborative is now open. So this was formerly known as the STS Mentorship Program. If you would like to learn more about the Data Manager Collaborative, please review the August 14th webinar, our August 14th monthly webinar. Addie gave a great presentation about the STS Data Manager Collaborative, and I have also included a link to that webinar that is posted out on the STS YouTube page. Our fall 24 harvest update, that data is in analysis and is just about complete, and the data set will be going over to IQVIA, and those the fall 24 harvest reports will be available, I would say probably late November. We'll share more information on exact time frame once we get that information from IQVIA. And again, that fall 24 harvest analysis does include surgery dates of July 1, 2021 up through June 30th of 2024. And also just a note that this will be our first report containing all version 5.21 data. The 2020, I've had a few people ask me about the 2025 harvest schedule. So that is coming soon. Carol, Nancy, and I will be working on that here probably next week. And just keep in mind, I don't foresee dates changing much from our usual spring harvest. Typically closes around the 1st of March. So within those first couple of weeks, so I anticipate our spring 25 harvest close to, be around that same time frame. So again, just, if you're trying to plan ahead, I would look for a harvest close around those first couple of weeks of March in 2025. And that will be posted out on the STS website as soon as it is available. Regarding the fall 24 harvest, I just wanted to briefly touch on the fall 24 reporting updates that are coming down the pike with this report release. Again, we have the implementation of the revised risk models. Dr. Cedar did present on those at this year's AQO. We have the resection for primary lung cancer and esophagectomy. The lobectomy for lung cancer risk model results will no longer be reported out. However, the lobectomy legacy reports will remain. The STS and NIS comparison outcomes reporting will utilize the resection population now. Previously, it utilized, again, just the lobectomy population, but the STS NIS comparison will now utilize that resection population. We are removing the required fields criteria, and just a friendly reminder that even though that required fields criteria is going away, this does not mean that you should no longer collect these data. And just to give you an example, analytics continues to see, even though, we do not require you to collect ECOG, things like that. It's not a required field any longer. Just to know that unfortunately analytics is continuing to see a slight increase in the overall percent missing for ECOG score. So, we do continue to look at the data. We will continue to look at the data moving forward since this required fields criteria is going away. So, again, even though we have introduced this no more required fields criteria, please, continue to collect this data. And again, regarding the ECOG, we just please continue to plead with your providers that to please document ECOG moving forward. Just a reminder, just let them know if they don't document ECOG, that patient will be assigned the least possible risk. So that will, I'm sure, get their attention. Also for the fall 24 reporting updates, the GTSD analysis overview will be updated to reflect these fall 24 reporting changes. So that overview that gets posted along with the release of the reports will be updated to reflect these new reporting changes for 2024. All right. What do we have next? ALCO, AQO 2024. Thank you to everyone that registered. Thank you to our in-person attendees, and thank you to our virtual attendees. Just wanted to go over some dates to keep in mind. Our Hot Topics webinar is scheduled for Monday, October the 28th from 1 to 5 p.m. Eastern. For that Hot Topics webinar, we invite our speakers to come back and give give an overview of their presentation. We're not going to have all new presentations. We just invite several of our speakers to come back, give a high-level overview of their presentations, and it gives you all, the attendees, the in-person attendees, as well as our virtual attendees, opportunities to ask questions to our presenters. So bring your questions to our Hot Topics webinar. We'll have our presenters there to answer your questions. So we look forward to having you join us for Hot Topics. Our marketing team will be sending out information regarding Hot Topics in the coming weeks. So again, just, mark your calendars for Monday, October the 28th, and we hope that you are able to join us. The virtual pass for anyone who has not or did not register for AQO, we still have, you still have the option to purchase that virtual pass up until November 15th. So I believe the prices for the virtual component for STS members, that is if you yourself, not a participant, but if you yourself are an STS member, I think the price was $400, and then STS members or non-members was $500. Please correct me if I'm wrong, Emily, but I think those were the prices. So again, that virtual pass is still available for purchase until November the 15th. AQO content, all of the GTSD recordings and all of the content is now available on the virtual platform. So if you haven't signed in or since the AQO, please know that all of the sessions have now been uploaded to the platform. So all recordings are there. So please go and check them out. And that AQO content will remain on our virtual platform until Friday, December the 13th. After that date, the AQO content will be moved over to the STS Learning Center. Our CEU deadline is Friday, December the 13th as well. So if you need to get your continuing education credits, the last date to claim the credit is Friday, December the 13th. All right. That is all that I have for STS updates. Next, I'm going to turn things over to Paul and Banu for their part of today's webinar.
Thanks, Leanne. Hi, everyone. Thank you for joining us today. So today, Paul and I will cover the new MPI validation functionality and also talk a little bit about how to best utilize the STS database help desk support so we can all have a more streamlined, fast, and easy way to respond to your inquiries moving forward. So next slide, please. As Probably most of you know by now, back in May 2024, there's been a new functionality that's been released on the database platform. It's called the MPI validation functionality. It impacts participants using a third-party software vendor, and this feature ensures that only the cases of surgeons or anesthesiologists on your contact list are accepted into the database. So if you upload a file that includes cases for a surgeon not on your contact list, records will trigger a critical error and the cases will not be accepted into the data warehouse. In addition to that, any records with an incorrect MPI number will also trigger the same error message and will reject all of those cases from the database platform. So you need to add all your surgeons and anesthesiologists to your respective PIDs if you're uploading cases for them, including the anesthesiologists and including your locum surgeons. Next slide, please. So what happens if a surgeon is not added to your PID and you have uploaded cases for him to the platform? Well, you will get a critical error message just like the one you're seeing here. This is an example of how you will see that critical error in your DQR, your data quality report. If you see a critical error message after your upload, just like this one, once you click on the critical error, which is the red part of the pie, it's very slim here, but sometimes it's a lot larger than that. You can see the details of the critical error list underneath that graph, and you probably will see a message that says anesthesiologist or surgeon invalid MPI error, just like the one here. That means those surgeons or anesthesiologists need to be added to your PID so you can successfully upload their records. Next slide, please. So if you see a message that says record XYZ is referencing an invalid surgeon anesthesiologist MPI, that means your record has been skipped during that upload, which means it's been rejected. So the first thing you need to do is opening your contact list report on the IQVIA platform. Compare your surgeons or anesthesiologists in your upload data with the context in the contact list report. So if they are not on your report, then you need to submit a participant contact form and a signed Schedule A or a Schedule B form, depending on if, whether it's a surgeon or an anesthesiologist, to get them added to your PID. So if all surgeons and anesthesiologists in your data are on your contact list report, then you need to compare the NPI numbers in your data with the national registry and then update your data with the correct values before you re-upload your cases. Next slide, please. So please note that not everyone has access to the contact list report. Only primary and backup contacts can see and access this list through the database platform. And if you're a primary or a backup contact, once you log into the platform, you can click on the operational report section, as you can see here on the left side. And then you will see and be able to access your contact list report at the bottom of the screen there, just like this one here. Next slide, please. So once you get into the contact list report, this is how you will see the list of names and corresponding roles of the individuals on your list. The only difference will be, since I'm using a test site here, there are no contact name listed here, but you will see the contact names as well as the roles of the individuals on your list. Next slide, please. So for those of you who've never done this before, I'd like to start off by reviewing how you can add context to your contact list report. So let's say that there's a new surgeon you'd like to add to your PID, or there's a surgeon or an anesthesiologist or a contact, any other contact you'd like to deactivate. In all of these cases, the participant contact form is the correct platform to initiate all of these change requests. That's actually the only way. So participant contact form, in short, a PCF, is an online form that you can fill out and submit, and it allows STS to make those changes that you request. It is the fastest, the easiest, and only way to make those changes. There are multiple ways, excuse me, there are multiple ways you can access a PCF form. You can go to the SCS website and put participant contact form on the search bar and hit search, and then you will easily locate this form. Or you can go to the website again, the SCS website, then on the research and data, there's the data managers section, which I'm sure you're very familiar with, you can scroll down and click on the participant contact form under essential forms and resources there. It's a pretty basic one-page document where we ask for the full name, MPI number, email address, etc. of the contacts you're adding to your PID. And once you fill out the form, you click submit, and then you're done. And on the right-hand side, you can actually see the SCS participant contact form. The good thing is that it allows you to send multiple requests with one form, but please note that a separate form needs to be submitted for each PID. So under one PID, you can send multiple requests, including additions, changes, deactivations, but it has to be for that PID only. Next slide, please. So we do receive questions around which database participant role you should assign to a new contact whom you're adding to your PID. And there's a document for that. It's called the participant roles and descriptions document. So please review that for a detailed explanation on each role before submitting the participant contact form to decide on the level of access you'd like to assign to the participant. That document is also located under the data managers section, again, under essential forms and resources. Next slide, please. I just want to mention one thing here, because we do receive a lot of a considerable number of PCFs without Schedule A's and Schedule B forms. And please note that we cannot add a surgeon or an anesthesiologist to your PID unless we do have assigned and filled out Schedule A or Schedule B form. This form basically gives us the permission to work with that surgeon's data, so you can understand why we're not able to add a surgeon or an anesthesiologist without those forms. And furthermore, contractually, you're required to provide us with one while you're adding these roles to your PID. So if you don't send it the first time you're submitting the form, we will definitely get back to you asking for a signed and filled out one. It just makes it easier if you attach that form within your PCF the first time you're sending it over. Next slide, please. So these are just, the Schedule A and Schedule B forms. They're really not very different from each other. Again, you can access these forms through the SCS website, as mentioned on the previous slide, under Essential Forms and Resources. Next slide, please. This one is actually an important information to know, as only primary and backup contacts should be submitting a participant contact form. If we receive a form submitted by any other contact, we will have to loop in either the primary or the backup contact, or one of the backup contacts, and request their approval before we can process this form, which will definitely delay the process. So we encourage all of you to have your primary and backup contacts submit the online forms, please. Next slide, please. So a couple more information before I turn it over to Paul. We do, as I mentioned previously, we do confirm the credentials of the people sending the submitting the PCF forms. It has to be the primary contact or the backup contact. If a DQR reaches out to us asking for a change or an addition, we will have to go back to the primary or the backup contact to get their approval. So please make sure that it's the primary or the backup contact submitting those forms. Usually the processing time is 5 to 7 business days, but most of the time it's a lot sooner if there is not any increased activity due to any changes that are being made on the platform. Just like right now, till October 11th, we have requested some contact updates from our participants, and there are tens and sometimes hundreds of them that we receive in a day. So it might take slightly longer during those times, but usually our processing time is 5 to 7 business days. And any requests that are sent via email, like, oh, can you add this surgeon or can you add this person as a backup, will only delay the process, because we respond back to them, encouraging them to submit the form. Otherwise, we're not able to add any participants, any individuals via email. So this is all from me today. I'll turn it over to Paul for the next session. Thank you.
All right. Thank you, Banu. Hi, everybody. So what I want to do is kind of go over some of the details of how the help desks work and how you can communicate with them. So if you need help with anything at all, hopefully this will make it easier to get answers to your questions and get the help that you need. So next slide, please. All right. So there's several help desks. Mainly, there's three main ones that we work with, and I'll start with probably the biggest one is basically what we refer to as help desk. It's the STSDB underscore help desk at sts.org. That's the email address you should send your questions into. And this one help desk is probably going to cover probably about 90% of your questions. So if you're having trouble logging in, your password seems to be locked up, or so you've forgotten your password, you're getting in, but you don't have access to the parts that you think you should be able to see, that sort of stuff, that would go to this help desk. Any questions you have, if you're having trouble submitting data for those of you using vendors, if you have questions about submitting that file and you're getting messages in the data quality reports that you don't understand, that goes to this help desk. If you're looking at your reports and the analysis that comes out after the harvests are done, you think something doesn't look right or you don't understand what the numbers mean, that comes to this help desk. Um, if you have questions about your vendors, now to be clear about this is if you think your vendors work, software isn't working the way it's supposed to, or you're having some trouble with your vendor or whatever, you want to change your vendor or something like that, that comes to this help desk. If you have questions about your vendor software, that we can't help you with. That you have to go directly to your vendor for. When nobody at STS by design is familiar with the inner workings of the vendor software. So we can't tell you how to do anything within the software packages. You have to go directly to the vendors for that. But if, again, if you have questions like my vendor says this looks right and, IQVIA is not accepting it, that could come to this help desk here. For those of you entering data into the REDCap forms, so these are the supplemental forms for the other devices, plus the beta blocker and stuff like that. If you have questions about that, that can come to this help desk. So you can see it's like we encompass this one encompasses most of the things that you're going to be working on and most of the questions you're probably going to have. And in fact, if you're not sure which help desk to send a question to, this is the one to send it to. If you send it to us and there's another one that can help, we will gladly pass it on to the appropriate one and make sure that somebody there responds to you. So this is your default help desk. Next slide, please. All right. The other two that I want to tell you about is the one that we call the STS database. That's STSDB at sts.org. That's the help desk that you use for official business. So if you have questions about your contracts, if you're signing up for something like, you decide you want to start collecting data for the anesthesia module, that doesn't apply to thoracic, but in the other databases that makes sense. But things about like what data you're contributing and stuff like that, that's for this help desk. And then the invoices, basically anything about money that goes to this STSDB at sts.org help desk. The other one is the frequently asked questions. So it's STSDB underscore FAQ at sts.org. This one you can actually get to two ways. You can, the email is there. Really the better way to get it is going to the STS portal, the website, and there's getting down into there, like, I'm sure along with all the, you know, documents of the data specifications and stuff like that to help for the data managers. In there's a place where you can click to submit a question to FAQ. And that's basically, it just gives you a form to fill out and it sends the email to this email address for you. The nice thing about that is the form asks you all of the pertinent questions that we need to know to be able to answer your questions, like who are you? and which participant, and some of the details that you may not know that we need to know to be able to answer your questions. So, but either way, that's the location where you would go to answer questions about coding. You have a patient that has some unusual scenario and you're not sure how to answer the questions. You're not sure about the definitions that are in the data specifications. And just whatever your clinical questions and concerns are, they all go to this help desk. The people manning that help desk are much more clinically oriented and know the medicine side far better than I do. So that's the better place to send those questions. So that's the three main help desks that you should be working with. So next slide, please. Okay, so regardless of which one you're sending your message to, I want to give you some pointers on how to make sure that you're providing us with all the right information. For the most part, it's just the general email etiquette. Just be clear, concise, and to the point, and get all your information in there. The necessary information is the primary thing is your participant ID. We can't do anything without knowing who you are and that you are associated with this participant, and should be asking questions about this site and stuff. So you have to give us your participant ID. If you're getting those error messages like Banu was talking about, that had your records are being rejected and because of the NPI values, and you don't know why, send us the surgeon name and the surgeon NPI, or the anesthesiologist name and NPI. Make sure you're providing that information. So all of that is going into your message. The other thing that helps is making sure that you have a clear and concise subject line to your email. You want to think of this as being like a title. So 10 words or less should be fine. Trouble understanding this report, problem with uploaded file, forgot my password. Just a couple of words just to give us an idea of what the topic is that encompasses your question. When we receive these messages, it's automatically putting it into a system where we get these tickets and everything like that. And your subject line is kind of the title for that ticket. And it helps us to understand, like, if I see that it's you forgot your password or something, I know who's supposed to handle that. And so if it's in the subject line, that makes it a whole lot easier and a whole lot faster for us to be able to get to those questions and get them knocked out. And so that it really helps a lot to have a nice, simple, and a clear subject line to your email. And then the rest of the information you just put within the body of the message. The other thing that really helps a lot are screenshots. It's really true what they say, picture's worth 1,000 words. Showing us an example of the error message that you're getting, or the clip from the report, so that we can see exactly what number you're seeing that you think is not right, or you don't understand how we came up with that number. The screenshot really tells us a whole lot of information. And a lot of times there's stuff in the background of the screenshots that we get that has the answer for us. Like, a lot of times somebody will send us a screenshot and we'll realize, oh, wait a minute, you're on the wrong form. That's why you're not getting what you want. And it's because we get an example of what you are seeing. And so that really helps a lot to get a screenshot. Now, when we understand different people have different levels of technology and stuff, but we get a lot of photos of laptops as a screenshot. And so what I want to do is kind of show you a quick and easy way to do an actual screenshot, because the photographs don't always give us the details that we need to see. A lot of times, we have to blow it up to see what the text is that's on the screen, but then it becomes too blurry for us to read. So a screenshot is far better than a photograph. And so what I'm going to do is give you a quick tutorial on how to do a screenshot here, for those of you that don't know. So I'm going to take over the screen here and see if I can find the share button. There it is. I'll do that and share. Okay. All right. So let's say, let me get this other junk out of the way. All right. Let's say I just uploaded a form here and, or I just uploaded a file into the database, into the IQVIA platform, and I'm trying to figure out why some of my records are not being accepted. And you're not understanding how to read this tile here that gives you some of the information about the file. Okay, so the way you want to do this is now what I'm explaining is how to do this using Windows. So if you're using an Apple product, Macintosh or whatever, you're going to have to ask somebody else how to do this, because really applies just to the Windows users. But for Windows users, you want to you want to click three buttons at the same time. It's the Windows button, the Shift button, and the S button at the same time. And I'll show you in a minute what the Windows button is in a second. So you can't see what I'm typing on my keyboard, but I'm pressing the Windows, Shift, and S. And you'll notice that my whole screen kind of goes gray. Okay, and I get this little plus sign here that is my cursor. But I can see what's on my screen. And so what I want to do is just come to the part that I want to have the screenshot of, and I go to the top left corner, and you left click and drag it to the right hand, to the bottom right hand corner. So I start here and I left click and I drag it down to the bottom right and let go. And now the screen goes back to normal. And what the system has done is it has taken a snapshot of that and it put it onto my clipboard. So now if I open up the email message that I'm sending to help desk, you just put the cursor into the body of the message and right click and say paste. Oop, and it puts it right there. Okay, now you can see that I got rid of all of the other background noise, like, all this stuff over here for, picking the dates that I want to see and, my titles and everything up there. I don't see any of that. I was able to concentrate right on the error message that I had the question about. So when you send this makes it nice and clear to see what's going on. Okay, and you may be wondering, why am I getting this X up here? And is this causing me problems? And what I'm noticing is that the name of the file is not following the correct format. So that's telling me that something else is going on in the background, that, somebody else is creating this file for you. It's not being created correctly from your vendor software. Okay, so, sending us the screenshots often tells us a lot of information that you don't even see that's out there and stuff. So, so that's the way you do a screenshot. And so I'm going to stop sharing. So Leanne, can you share again? Okay, and so if you notice here, when including the screenshot, that little thing there, that's what the Windows button looks like. So you're hitting the Windows, the Shift, and the S all at the same time, and that puts you into the screen capture mode. All right, so that's the things that you want to do. You want to have a nice, clear, concise subject line. You want to provide as much detail as possible in the body of the message and provide pictures whenever possible. So now a couple of things that you don't want to do. First of all, and most importantly, don't send to multiple help desks. If you know the names of all the help desks, you're not sure which one to send it to that one, the STSDB_ help desk. That's the one to send it to if you're not sure who should cover it. But what happens is if you send it to more than one, automatically you're making work for somebody who is, as I explained, each help desk has their own area. So if you send it to multiple help desks, you're automatically sending it to somebody who's not supposed to get it. So all you're doing is creating work for them. And then inevitably what they're going to do is they're then going to forward it to the help desk, okay, to the correct one, which you've already copied on there. So now there's two of them out there. And now that there's two of them out there and there's multiple people manning that help desk, one person might grab one and another person grabs another, and we're both trying to solve your problems at the same time. That's not a good thing. Sounds like it's a good thing, but it's not. We had a problem with that this morning where we stepped on each other, two people trying to help one person at the same time, and we ended up causing more problems than helping. Okay. So it also, just like every time we get these email messages, it creates these tickets that we then have to go in and process and close out and sign off on and stuff like that. And so really all you're doing is just bogging things down and making things slower for everybody. So make sure you send it to just one help desk, and when in doubt, send it to STSDB_help desk. You also have some individuals. Some of you have gotten a hold of individual people's email addresses, like Leanne or Carol or myself. And so you copy help desk and these individuals. Don't do that either, because that's not helping. Okay, the help desk is the right group, the right way to get your questions answered. There's multiple people handling the help desks, and if somebody's away on vacation, there's somebody covering for them. So there's always somebody there monitoring that email, and we'll be able to respond to your messages a lot faster if you just stick to the help desk. Don't send it to the individuals. You're just creating extra work for them that they don't need to be doing. And lastly, I wanted to point out, don't send emails directly to IQVIA. I know that the IQVIA platform has some things on there that say, if you have questions, use this link to send a message to their help desk. Their help desk is the master IQVIA help desk. It's not the one that's specific to STS. And 9 times out of 10, that's going to get lost in the shuffle if you send it to there. Okay. The only time you want to send an email to IQVIA is if somebody from IQVIA sends an email to you and you're just responding to it. Then it's okay to do it that way. But if you're initiating a question, don't send it to IQVIA. Send it to us, because STS is handling 99% of the questions. And if your question is something that we need input from IQVIA, we refer to that as our tier 2. We'll bump that up to tier 2, and there's a separate group that you don't have access to that we'll send it to. They're familiar with the STS product and the whole process and everything that we're doing, and they can get your questions answered very quickly. They've been trained on how the STS databases work and everything. So there's a specific team to answer those, and the only way you get to them is coming through the STS help desk.
Well,
So
I
that's
quickly want to add something here.
sure.
Yeah. One last thing is that please do not send multiple emails to the same help desk for the same issue. It again creates the same problem Paul was referring to earlier, where one is assigned to one person and the other one is assigned to another, and two individuals working for the same issue, stealing time away from other emails that we need to attend. Rest assured, we received your email, and if we're not answering it right away, that means we do have a lot more emails in the inbox, and we're just tending to them as we receive them in the order in which we receive them. But we will get back to you. Thank you.
Okay, good point. Thank you, Benno. All right, next screen, please. All right. Yeah, and I apologize. We're giving this presentation to each of the registries, and this one more applies to the adult database. But just to give examples of our ineffective emails versus an effective email, we do literally get questions like, "Why does this report say that I only have 125 patients?" I don't know who they are. I don't know what report they're talking about. I don't know what total they're talking about. Almost every report has a total number of patients listed in it somewhere, some of them in multiple places with different filters. So I have no idea. And what we end up with a question like that is I have to go back to the user again and say, well, what do you mean? Who are you? Which report are you looking at? Send me some screenshots. So it just takes time for us to have to send that additional email, and it also just makes it that much longer before you get your answer. So if you provide all the details up front, we can get the correct answer to you a whole lot faster. So, so a more effective email is, now again, this is in, speaking in the adult registry, but, in the risk adjusted reports, my report period that I'm looking at ends March 31st of 2020. Looking at the benchmarks reports for filtered down to isolated cabbages, the number of cases that I'm seeing for 2023 is 125, and I think it should be 130. Okay, that's right to the point. I know exactly what report you're talking about. I know what filters you've applied to it. I know what number you're seeking, and you've told me what number you think it should be. So now we can dig into this and we can come up with an answer to your question without having to go through a whole lot of back and forth with you. So that gives you an idea, like the kind of details that helps us to be able to answer your questions. All right, next slide. All right, so usually we will respond to your email with an answer within 48 hours. We say 48 hours because a lot of times, if we get backed up with a lot of questions, especially towards the end of a harvest, but the truth is we usually get all the questions answered by the end of the day. I know Banu and I, make a point to make sure that before we leave at the end of the day that we've answered all the questions that we can answer. There may be some that we need additional help and additional input from somebody else, and we're looking into that. But any of the questions that we can answer, we usually get them answered within a couple of hours. And definitely, we try really hard to have them done by the end of the day. But sometimes we can't. Sometimes we have other things that we're working on. And it may be that, a harvest is coming to an end and it's not the thoracic database, it's the adult database, which you may not be participating in. So, it may not seem relevant to you, but we're swamped with questions from other users and stuff. And that's when the questions get out to about 48 hours or so. So do be patient with us if you can. But should be within 48 hours. So, all right, next slide.
Paul, just real quick, when you say end of day, what time zone are you referring to there?
I'm just saying that,
Yeah.
if you send me a question in the morning, you'll
Yeah.
probably have your answer by the end of the day.
Yeah.
If you send me a question at 4 o'clock Eastern time, probably not. It'll be the next day. But yeah.
Our help desk isn't 24 hours, just to.
Correct. Yes,
Yeah.
it's not. Yeah, this is not a 24-hour help desk. This is a regular work day. We're not here on the weekends. We're not here all night long, stuff like that. We don't have the resources for that. So, all right. So that's our input for getting help to you. And Leanne, I don't know how you want to do questions. If you want to do questions now or wait until we're completely done and.
Yeah, we can we don't have very many questions, so we'll go ahead and let Ruth do her education, and then we'll come back. We just have a couple of questions in the inbox right now.
Okay, so I have an educational update only on one quick topic. This was discussed to some extent at AQO, but I wanted to just put together a couple of slides on this because I think it's a really important clarification. So I've received several questions over the last few months about incidental therapeutic lung cancer resections. So patients can be taken to the OR for lung resections for many reasons, often not related to a suspected cancer of any type. So for example, lung resections performed for the purpose of recurrent infections. So sometimes surgeons will do multiple diagnostic wedge resections because a patient has recurrent infection and they want to get a better idea of a good sample so that they can better treat that infection. Sometimes surgeons will do multiple diagnostic wedge resections to further characterize chronic lung disease for treatment purposes. We know that patients sometimes have blood resections, or treatments of spontaneous pneumothorax. So those resections are therapeutic in the sense that they're treating the patient's disease, but that disease is not lung cancer. And so if there is no lung cancer in that resection, the case is not required for entry. Whenever surgeons remove tissue from a person's body, it's always sent to pathology for evaluation. And on rare occasion, what happens with these lung resections that have been completed for other purposes, not the purpose of lung cancer, pathology will incidentally identify that lung cancer was present in these specimens that have been removed. In these instances, if the lung cancer resection is complete, meaning the patient's not going to have other treatment for this lung cancer, which happens in most cases, because if you think about the fact that the patient was not taken to the OR for lung cancer, any lung cancer that's removed generally is very small. And so all of the lung cancer is removed in these resections. In those cases, the case should be captured and it should be entered into the registry as a therapeutic resection. The only exception to this rule is for patients who have a pneumonectomy performed as part of a transplant operation. So if the patient's entire lung is removed because they're getting a lung transplant, those cases would not be required for entry. If you want to go to the next slide. The training manual already provides guidance on how to manage clinical staging for these types of cases. If you look at sequence 1600, if a procedure is scheduled as a diagnostic procedure, and then based on specimens removed during the procedure turns into a therapeutic procedure, you would code no to clinical staging done lung sequence 1600, unless other preoperative clinical staging was performed. If you want to go to the next slide. The training manual does also provide guidance already on specific scenarios. Unfortunately, they're sort of scattered about the training manual in various locations just based on the way that the questions have been asked, linked to sequences or being presented initially as example cases. So there was a June 2022 FAQ. So in instances where a CABG is completed as the primary procedure, and a therapeutic resection for lung cancer occurs in the same trip, the lung cancer or the lung resection should be entered into the database. Another example, there's a section of the training manual, and I don't know, Leanne, if you have it pulled up, but there's a whole bunch of cases where when we developed this version of the training manual, we're trying to anticipate some of the questions that people might have. And so we went through just a bunch of cases. And in this case, the patient had a history of breast cancer. Yeah, it's right there, case number 5. The patient had a history of breast cancer, previous METs to the lung. So the surgeon took them to the OR thinking they're going to be taking out another MET. It ends up being an early stage primary lung cancer. Does this case have to be entered? Yes. So even though the intent of the surgeon was not to take this patient to the OR for a therapeutic lung resection, in the end, a therapeutic lung resection was performed, and so the case is required for entry and would be analyzed, assuming that the patient, wouldn't be eliminated from analysis for other reasons. So age, stage of disease, et cetera, et cetera. And so that's my quick, brief educational update for this month. I have responded to the data managers that had questions outstanding on this topic for many months. And again, I thank all of you for your patience as the core group and the task force worked through this question.
A lot of conversation.
A lot of conversation. And I do think that it is quite possible that for the next version, this may change. I think we try to be very thoughtful about making major changes in the middle of the version, and this would be a major change to this version. And so we chose to leave it as it was originally set up when this version was published.
Yep, agreed. Thank you, Ruth. Okay. That's all that we have for today. So next we're going to turn things over for open discussion. While there are a few questions coming in before I hop over to questions real quick, I just wanted to touch on these dates. Our upcoming webinars, our next monthly webinar is November 13th at 2:30 Eastern, 1:30 Central, followed by our December webinar is scheduled for December the 11th at 2:30 Eastern, 1:30 Central. And then our quality improvement series, our next quality improvement webinar is scheduled for Wednesday, October the 23rd. I know these are typically scheduled to occur the last Thursday of the month. However, this month we have our ACSD Hot Topics webinar on Thursday, the 24th. So we had to move our quality improvement series call for October to Wednesday at 2 p.m. Eastern. Of course, marketing, it's the date and time and all the information is posted on the STS website, as well as our marketing team will provide, we'll send out an email prior to the webinar with the dates and times and the link for the call. So again, quality improvement series, next call is October 23rd at 2 p.m. Eastern, and our next monthly webinar is November 13th. Quality improvement, October 23rd at 2 p.m. Monthly webinar, November 13th at 2:30. And here's our contact information if you need contact. So let's go back to our questions really quick. Our first question from Nicole. Will the STS GTSD be launching longitudinal dashboards similar to the ACSD? So yes, our plan is to have the longitudinal dashboard similar to what we have for ACSD. Unfortunately, I don't have a date of when these will be available just yet, but they are in planning, and we do anticipate having these longitudinal dashboards available for the general thoracic surgery database. I don't know, Ruth, if you wanted to answer this, and what procedure code would you use for the blood resection?
So assuming that they ended up doing a wedge resection, and assuming that you're talking about doing an incidental resection of a lung cancer, you're going to use either the minimally invasive or open wedge resection codes. So 32666 is the minimally invasive CPT, and the 32505 is for the thoracotomy with therapeutic wedge.
Thank you. And then Heather asked, what did you say about clinical staging related to incidental therapeutic resections? And I put the slide back up here. And it's, oopsie, I'm sorry, Heather, here's the blurb in the training manual under sequence 1600. So you would code no to clinical stage done lung sequence 1600 unless other preoperative clinical staging was performed. And then our question from Beth, if a patient has a pacemaker but underlying cardiac rhythm remains AFib when pacemaker is interrogated, but I still document no to AFib under sequence 590.
Beth, if you could send that in as an FAQ, that'd be great.
Yep. Thank you. We could talk about that. And while we are waiting for other questions to come in, Carol, Emily, and myself, for our social media people, my face speaking specifically to our Facebook people, if you are out there, we have created an STS data managers page. It's a private group. Obviously, it's not out there for everyone. So we do have an STS data manager page if you are interested in joining. This is very new for us, so just be patient. You would have to request to join the page, and I think Carol has put the link to the Facebook page in the chat. So again, the purpose of this Facebook page is strictly for networking purposes. This is not a platform for you to ask clinical questions or discuss STS definitions. This is strictly a page for networking. You can post job opportunities. Let's see. I'm just looking at my notes to see what we had discussed. So,
and I would like to welcome Gabrielle Hoekstra as the first person from this call that's joined.
All right. Yeah. So, of course, we have group rules, so those are posted on the page. But, just remember, this is strictly to make, for networking, to make connections. Again, you can post job openings. But again, this is not to discuss clinical questions or debate STS definition. So we would love to have you join our group. So again, just be patient with us as this is a new process for us, and we would love to have you join and look forward to seeing, how this all pans out. Carol, anything else to add? Emily? Oh, I think Emily had to step away.
No,
Okay.
thanks, Lan. You did great.
Yeah, just, but yeah, we've got some AQO pictures posted out there. So if you would like to join and go see. Paul?
Yeah, I was just gonna before we get off, somebody had posted a question and Banu already answered it, but I just wanted to kind of point it out. They were asking about the response time for help
Oh, yeah.
desk. And are you going to get an automatic message acknowledging receipt of the email? We don't do that. We don't send an automatic message saying we got your email. I think in this day and age, you don't need more email. You can assume that we got it. And I do want to say that if I'm working on a question and I need to forward it to somebody else, or I need input from somebody else, and I know it's going to take like at least a day or more before I get the answer, I will reply back and say, I'm working on your email, and we'll have an answer for you soon. So in that sense, we will communicate with you, but really what we're trying to do is just get the answer for you and get it back to you as soon as possible. So that I like Banu's answer. I just wanted to make sure everybody was got to see that. So that was it.
Awesome. Let's see here. It looks like we have several people signing up to join our Facebook group. So great. Awesome. Thank you guys. We look forward
Yeah.
to it. Let's
If
see.
people could answer the questions, I'm able to check people just because I can see who's on the webinar with us and I know names, but don't forget to answer the questions.
Yeah.
If you can.
Let's see. Is there a way when I think she meant viewing IQVIA or cleaning IQVIA to view all major morbidities in one export? Honestly, Nicole, I don't, Ruth, do you know off the top of your head? I don't know. Nicole, if you want to shoot me that in an email, I'll take a look, but I don't have the answer off the top of my head. Honestly, I don't know. I would have to look into it.
Are you talking about well, yeah,
All major morbidities.
I'm not sure what, I have clarifying questions. So yeah, probably an email would be helpful and we can follow up.
All right. Is there an estimated timeline for the next version to be released? So Elizabeth, we are right now, if everything goes according to my plan and everybody follows my timeline and my surgeons on the upgrade cooperate with me, we are planning to go live in 2026, beginning of 2026. It's a big, yeah. So that is my plan. And I'm keeping them to my timeline. So, but yeah, so 2026. The plan is to go live January 2026. Any idea, Emily, this is a question. I don't know if you know this, but when CoreXL will start sending out CEU certificates for AQL?
Yeah, so it is a rolling submission over 3 months. So and then it'll probably be coming up here in the next couple days because it was September 13 was the last day of our meeting. So about October 13 or so, November 13 to 15 or so, and then December 13 will be the periods of when they will be sent. So they'll collect for a month, send a certificate, collect for a month, send a certificate.
Awesome.
And I do have the dates for all of the hot topic sessions and I can put them in the chat.
Awesome. Thank you,
And I
Emily.
can say it out loud too. So congenital will be on October the 22nd. Adult cardiac will be October the 24th. General thoracic will be October 28th, and Intermax and PDmax will be October 29. We will be sending out email communication about all of the sessions for AQO being on the platform tomorrow. And then in about a week prior to your webinar, attendees will get an email with a link. We will not be putting it on the website. And that's it.
And awesome. And I think Ruth had one more thing she wanted to ask about.
Yeah, related to the hot topic session coming up for GTSD, I know that at AQL we reviewed pathology reports and PFT reports that were submitted by data managers, which I think was really great to have a variety of samples. I do have a couple of pathology reports that were previously submitted that will be reviewed at the hot topic session, but would love any additional pathology reports or PFT reports that you would like turned into questions for the group at large so that we can all learn from each other. So please send them either to my email or Leanne's email, and we will get those sorted for the hot topic session, please.
Yeah, and I put Ruth's email in the chat. It's rriley@sts.org, and mine is ljones@sts.org. So,
Thanks,
yep.
everyone.
Yep. And regarding our STS Data Managers page on Facebook, if you have friends over in the ACSD world or the CHSD world, please let them know. We'd love to have them join as well. But again, please answer those questions so we can verify who you are. We'd like to keep our little group private so we don't have spammers in there. So, all right. I am not seeing any additional questions come in. Looks like we are actually 2 minutes over. So thanks everyone for joining today. Hope you enjoyed today's webinar. Lots of good information. Thanks team, Ruth and everyone from STS, Katie and Ruth. So thanks everyone. Hope you guys have a great rest of your week, and we will see you all at our QI webinar and then our next monthly webinar and hot topics. Lots of things coming up. So thanks everyone for joining. We look forward to seeing you guys.
Leanne,
Thanks.
there's one quick
Thanks,
question on hot topics in the chat. Do you want to
Oh,
put that one?
Emily, I don't know if you want to.
If you weren't able to attend AQO, so you have to either be a virtual attendee or an in-person attendee to attend the Hot Topics webinars. But if you weren't able to be there in person and you're a virtual attendee, yes, you will be able to attend.
Thanks, Emily.
Yeah.
Thanks.
Thanks, everyone.